It is now time to ask the expert. Here to answer your questions live on the air is Dr. Natasha Bhuyan with One Medical. And first up, can heartburn be a sign of worse things to come medically?
Well, this is such a good question because, heartburn oftentimes is just heartburn. But there are instances where if you have symptoms of heartburn and you're not sure what it is good to check in with a doctor because it could be something else. It could actually be related to cardiac or your heart. Wow. The other thing that's important is there are some people that have heartburn and they are at higher risk of actually developing esophageal cancer. I know that sounds really dramatic, but especially if you have severe heartburn symptoms, there is a category of people that benefit from certain medications. And so it is good to check in with a doctor, including your primary care. They might send you to a GI doctor for regular monitoring.
Okay, especially if it persists. Okay, good question. Phil in Phoenix says, I've been on a PPI for GERD for 27 years. I'm experiencing hair loss and attribute to the PPI. Is there an alternative?
Yeah, so Phil, this is such a great point because PPIs, we talked about before, so many people take them and they take them every day for decades. I have so many patients in the same boat as you, and then they'll notice they end up having lots of side effects. Hair loss is one of them. I've commonly seen that. So, what I tell people is if you're able to take something like an antacid or an H2 blocker instead, so things like Alka-Seltzer or Pepcid, it is better to use those. Now, they are weaker, so they don't work as well as a PPI, but if you can take those, it's a better option. And the things I talked about before, the number one change I see is when people make changes to their diet, that actually helps heartburn the most. And so if there's other things that you can do to change your diet up or try those natural remedies, those are certainly better than being on the PPI. And if you wean off, just slowly wean off the PPI since you've been on it for so long and chat with your doctor about how to do that safely.
And we did talk about food diaries, which is this next question. So how long should I track my diet before changing it up if the heartburn doesn't subside?
Yeah, a rule of thumb is 2 weeks. So when you track your food, track it for 2 weeks. What happens is people, they'll eat a food and then they develop heartburn like a few hours later and they're like, wait, what did I eat? What could it have been? And so it is good to track your food so you can figure out the symptoms and then change your diet up and try a new diet for 2 weeks. If you notice it's not working, then try another diet and talk with your doctor.
And use that sugar-free gum or those bananas, licorice and the low-fat yogurt.
Try all the natural remedies.
Yes. Okay, next question. My heartburn tends to get worse overnight. Is there something I can do to ease it before bedtime?
Yeah, I see this a lot. So a tip that I didn't mention before is make sure that you wear loose-fitting clothing overnight. So when people are wearing really snug, tight clothing, that can make heartburn worse. The head of your bed, use a lot of pillows so you elevate your head. That way you don't have the acid just going into your esophagus. And then the biggest tip is don't eat close to bedtime. So try not to eat a meal at least 3 hours before bedtime because if you eat too close, that triggers the heartburn.
Okay, elevating the pillows, I think that's a big one because a lot of us will lay in bed for several hours before actually falling to sleep. So maybe just stay perched up.
Yes.
Dr. Bhuyan, thank you so much.